Hi YouTube, I'm your fave nurse B. Today I want to tell you all how you can stand out in nursing clinicals. Alright everybody, so in order to stand out in nursing clinicals, the number one thing that you need to go into clinicals with in your mind is that this is like a job. Look at it like you're going to work. Not like you going to work like after you've been at a job for 2 years, you kind of just going in, chilling, you know. I'm gonna just half-ass it type of thing. No, you need to go through it as if it's like that first 90 days of a new job. So the first thing you need to do is make sure that you're on time. Can't stress how important it is for you to be on time for clinicals. Like I said, look at it like it's a job. Make sure that you're setting all your clothes out the night before. Anything else you need to set out, your lunch, your clinicals bag, whatever. Get all that together the night before and get yourself, you know, up on time and get ready. Make sure that you're presentable. You know, your hair, your nails are presentable. If you wear makeup, whatever the case may be, but just be presentable. You don't have to be like flawless type of deal, but just try to go in, you know, like I said, like it's a job. So make sure that you're presentable and you're professional. In most schools, they have some type of requirement when it comes to nails, ladies. So you might have to have them where you're looking at your nails like this, your hand like this, and you're not able to see your nails over your hands. So right now I would not qualify. Some nursing schools have that, or you have to have like a natural length, or it can't be like any color or no fake nails. Some schools have those rules. Some are strict about it, some aren't. So you know, it just depends. You don't want to wear big earrings. It's just like I said, look at it like a job, or like if you're going on an interview. If you're gonna wear earrings, wear studs, you know, have minimal makeup, those type of things. Okay, make sure your scrubs are clean and ironed, all that. This is stuff that you should already know, but so many people, they don't do it. And I understand when you're in nursing school, like you can be like extremely tired, worn out, like the last thing you care about is ironing your scrubs. But I encourage you to do it, okay? And I also encourage you to subscribe, so go ahead and do that, and also rate, like, comment, and share. All right, and join the Facebook group YourFavNurseB. All right, so let's get back into the video. The next thing that I want for you all to do is to make sure that no matter what, your professors, typically your clinical professor, they will be a lot more relaxed in a clinical setting. I guess because, you know, in a classroom you just have to sit there and everybody has to sit, be quiet while the teacher talks type of thing. But in a clinical setting, it's more lively, it's other people involved, like you're hands-on. So the teacher might be a little bit more relaxed with you. Even the most strict teacher in a classroom will be like a little bit more relaxed in a clinical setting. But never should you ever see that as a point for you to become relaxed. You should be relaxed, but not to the point where you're cursing in front of your instructor, where you are, you know, saying negative things about other instructors or other classmates, or you're bashing the people at the facility that you're in, or bashing the facility. Just think about it. That professor, at the end of the day, is a professional. They are a nurse. They are gonna look at you. They're looking at you in this setting, which is like a job-like setting, you all. And if you are depending on these people to write you, you know, some type of reference or anything like that, they're going to go off of how they see you, not just in class, not just the grades you get, but how do you actually act in the setting in which you're going to be in when you become a nurse. So don't get lost in the sauce, y'all. I'm telling you, do not get too relaxed. And also, with that being said, you need to make sure that, now me, myself, I'm very talkative. I love, like, once I get comfortable, I love to like find somebody in a group and like we gonna be good, like we about to have fun, even though it's clinicals. But That's fine, but make sure that you want to stand out. You really want to stand out, and the best way to do that is to be flexible as well. You need to be able, like the teacher says, you know, I need somebody to do this. Boom. Okay, I'll do it. Like, always say yes. Always say yes. Oh, we're not gonna be able to go here, we gotta go there. Don't grumble about it. Like, okay, that's fine. You know, this is nursing, and nursing you have to be flexible. Boom. People love when you say that type of stuff. I'm telling you, because you have to be flexible in healthcare, because you're dealing with people. People are not finite. People are not, you know, cut and dry. Like, you have to be flexible. So make sure that you always say yes, no matter if it's something that you want to do or not. Oh, I need for somebody to write out this. I'll do it. I need somebody to take this person to the bathroom. I'll do it. Like, you need to be on top of it. I'm telling you, you will stand out. It just shows that you're a team player. It shows you're down to do anything. And I'm telling you, when these teachers you want them to write stuff for you, they're going to do it for you, because they see that you actually are doing your job. And also, depending on where you live, even a place like St. Louis, Missouri, where I'm at, it's a city, but it's still like a small town, in that, you know people. Even if you are, you know, even if you don't ask that teacher to write you a reference or whatever the case may be, that teacher might know somebody, the DON, director of nursing, if you don't know what that means. They might know the DON at a facility that you're trying to get in. And the DON, you know, might be like, oh, well, I saw somebody had went to your school. What do you think about them? It's so small. Like, people talk in the nursing community. They do. You think they don't talk, they talk. You think they don't look, they're looking. I'm telling you. So be on your A game. Stand out from the crowd. You might want to be cool with your friends during clinicals and kind of kiki, or you might want to be, you know, relaxed or lazy, or I'm not gonna do it. I'm not about to do this for free. I'm not about to do CNA work for free. No, do it. Okay, do it. You're there to get an education, especially if you're one of those people who are hands-on type of learner, like kinetic learners. Like, you need to take clinicals as a chance to really really broaden your mind, because at the end of the day, nursing is an art and a science. The art of nursing, it comes from like your compassion and all that, but it also comes down to what you are able to do physically for a patient. You can know everything, but if you can't actually do the work, in some sense you're useless. I mean, to be honest, some sense you're useless if you can't do the physical work of a nurse. Do womb changes, do vital signs, do your head to toe assessment, be able to, you know, check all these different things. You won't be able to do that if you don't get the clinical experience. And I say that to say this: in clinicals, you need to be fearless. Now, I'm not saying go out there and kill folk, no, but you need to be willing to make mistakes, because the way that you make mistakes is that you keep putting yourself out there to do things. So that's why I say always say yes, because the more mistakes that you make, the more you're going to learn from it, hopefully. And then also, this is your opportunity to make mistakes, because if you do make a mistake, it's going to either fall on your clinical instructor or the nurse who you are precepting with, or who's helping you throughout your clinicals. It's going to fall on them. It's really rarely is it going to be like, oh, they're going to throw you under the bus. No. Like, you're the student, they understand you're there to learn, you don't really know. So use this as your opportunity to get out there and make some mistakes by being present, by always saying yes. Because when you become a nurse, when you go to NCLEX and you know, pass and get your license, when you make a mistake, it's going to be all on you. So if you did not take that time to groom yourself and to make mistakes and to, you know, get out there and talk to patients, get out there and just kind of get your hands dirty, when you get there on the floor as a nurse, it's going to be really hard for you. It is. So clinicals sometimes might seem stale, might seem boring, like what's the point? But I'm telling you, any chance that you get to touch a patient, talk to a patient's family, any chance you get to do anything like that, just take it. The most small thing, I'm telling you, you can learn from any experience, okay? So just keep that in mind. I'm gonna be honest, clinicals can be boring as heck. That's why I say, if you watch my last video I just posted about my experience, I always try to find somebody in the clinical side that I was cool with, like, just to talk to, because it can be so freaking boring. And also, talking about being boring, stay busy. So part of staying busy is, like I said, always say yes. But another part of staying busy is, a big tip I would say is, depending on what you all are learning in class. So say, for instance, I don't know, say you're like, in med surg, and or say you're in fundamentals, since a lot of people are starting school right now. You're in fundamentals and you're learning about like constipation. Okay, so you take your study material, so watch some of my study videos, and you take some of your study materials with you, where there be flashcards, outlines, your graphs, all that little stuff. Probably flashcards though, because you can easily put those in your pockets. And like I said, I'm doing a video on flashcards that are like good flashcards. They're gonna help you out for real, for real. But you take these notes with you, and maybe in order to stay busy, like there's really nothing going on, you want your instructor to see that you're trying to do something. Plus, you want to use your time wisely. This is nursing school. You don't have that much time. Take those flashcards. Maybe you have like 3 or 4 other classmates that are just sitting around doing nothing. Maybe you all test each other. And you're going over this whole, deal with constipation that you all are learning in fundamentals. And you're looking at your patient, looking at all her meds and saying, oh, she's on this, and this is for constipation. So let me look at the signs and symptoms. Let me look up the side effects for it, or is there anything I need to teach her about if she was to use this, Let me go check my patient. Let me go ask her when was the last time she had a BM. Let me go look and see when the last time she had a BM. Let me listen to her, what do you call them, her bowel sounds, and see, those normal, those type of things. This is helping you to connect what you learned in class with clinicals. Also, you're using your time wisely, and you're engaging with your patient, a real life person, because constipation, trust and believe, you're going to come and have that issue with constipation with one of your patients. You're gonna have an issue with constipation with one of your patients, and you're probably gonna have to go in there and assess them. Like I said, listen to their bowel sounds. Ask them when the last time they had a BM. Is it normal? Do you have any abdominal pain? How much water have you been drinking? Those type of things. And then you look back at your meds, and then you're asking questions with your classmates. And if you're one of those people who learn with other people, this is amazing for you, because this is your opportunity to kind of have like a little mini study group while you're at clinicals. And like I said, you're using your time wisely. Clinicals, you can really use clinicals. It can be very beneficial for you all. It can. Like I said, it can be boring, but you can really use that time in clinicals to become a stronger student. This is a time for you to really have more one-on-one time with your teacher, because when you're in class, really their job is just to have you sit there, and they're there talking to you, giving you the information, because they have to give you as much information, like all this information. But when you're in clinicals, this is your time to go to them and be like, I'm really nervous about this, or the patient has this, and I'm just not really understanding how that correlates with what's going on in the book, what we talked about in class. This is your time to have that connection with your instructor. Rarely are you going to be able to have that time unless you go to them, during their during their office hours. But at clinicals, it's a really good time for you to connect with them, and then you have the patient right there, so they can go to you and say, look, this is what edema actually looks like on somebody. Okay, touch their skin, how does it feel? Is it warm? Is it cold? Ask some questions. Like, this is your time for your instructor to really help you to understand something hands-on. And sometimes, I'm gonna be honest, I've noticed a lot, and just from talking to other students, is that instructors don't always have they don't really, it's kind of like let the cards fall as they may when it comes to clinicals. Like, they don't have like a curriculum, like we're gonna do this, this, and this today. Even the most organized instructor, because they have to go they're at the mercy of that facility and what's available and what the nurses are allowing them to do and all this good stuff. So sometimes you can kind of help the instructor by asking questions, by pointing out things in your patient, and this will help the instructor to be able to teach you all while you're at clinicals. Because I'm telling you, it's a lot of times you're just standing around doing nothing. Even RNs, and I'm gonna let you all know I'm an LPN, but even RNs, I've talked to some of my RN friends that say sometimes at clinicals that they're just sitting there doing nothing. So use your time wisely. Another thing I would say is, and this is probably one of the biggest things, everything is big, but hey, a big thing is, do not get offended. You as a student, some people stay student and they say, no, I don't want any students, I don't want them on my hall, I don't want to deal with them, bye. Okay, Me, I love students. I love having students come to my freaking job. Like, I get so excited. I be trying to find something to do. Like, I love it. But some people, they hate it. And for whatever reason, you're in their way. They don't, they know that they're going to do things a certain way. They don't want you pointing it out. They don't want to answer questions. You're slowing them down. They don't want you to go back to your instructor saying this about them. Like, they're done with it. They don't want students. Don't get offended. At the end of the day, you're just a guest in their facility. You're just there to learn. Don't get offended. Don't start cursing people out and yelling and pointing fingers and all that. Don't get offended. If they don't want to help you, they don't want to help you. It is what it is. You know what I'm saying? Just, it is what it is. You just get in where you fit and try to do your best, okay? Some people, they just don't, I don't know, they just don't like students. I like you. So yeah, those are my tips. Basically, remain professional. Treat it as if it's a job. Always say yes. Always say yes. Be flexible. Make sure that you are using your time as wisely as possible, bringing in study materials, studying with your classmates, asking each other questions, things like that. It'll really help you because you'll be able to recall such and such said that during clinicals. You know, also another thing is to ask your instructors as much questions as possible. Try to connect what you're learning in class with something that you see in clinicals so that you can have that connection, so that you actually start to learn it versus just remembering something on a piece of paper or in a book. You actually start to learn it because you see it. You know what I'm saying? So, and the last thing is to not get offended. So those are my tips for how to stand out during clinicals. Stay positive. You can do it. I, for one, I dreaded clinicals. But I still had a good time. Make the most of it. Try to be positive. Have fun with it. And enjoy nursing school, you all. So I hope that was helpful for you all. I'm your fave nurse B. Like I said, like, comment, and subscribe. Make sure you share this video with someone who would be helpful for. And also join the Your Fave Nurse Facebook group. Peace.